Welcome to our latest video update. If there's any truth to the statement that absence makes the heart grow fonder, seeing as we haven't done one for a few weeks, people are probably just desperate to hear from us. So here we go. Really important time to connect. There's an awful lot of public activity, as you know, going on with the COVID situation across the province. Our numbers have seen an increase provincially, a fairly significant increase, and there are some very serious worries that we may be seeing the beginning of a large wave. So it's a great reminder for all of us to continue to do the little things. And I'm a firm believer that if we all do our part, all do the little things, physically distance, wear a mask, stay out of contact with people if you're not feeling well, make sure you have a bubble and stay within that social bubble. We all do those things. We will see the numbers start to level off and go down, but it does depend on us and how we act and how we behave as individuals. I want to talk specifically about our assessment center today. As you may know from previous videos, there are 4 locations across Huron Perth that are doing assessments/swabbing for COVID: Stratford, Goderich, Listowel, and Grand Bend. With the recent uptick in numbers, with the schools reopening, the demand on assessment centers has basically gone through the roof. We saw this week, as an example, 1,000 more calls in a day than we did the same time last week. So exponential increase, and obviously that has put pressure on the system. And I want to give a massive shout out to those who are in our assessment center, our staff, who are working tirelessly to stay on top of the demand, whether it's the administrative side, coordinating, booking, whether it's the clinical side, actually doing the swabs. I want to say thank you. We are looking at whether we can expand our capacity, and we will certainly do that if we are able. But the key, though, is to make sure that if you are thinking you need a swab, to ensure you either have symptoms of COVID, you have been recommended through public health, through contact tracing, or there's another specific requirement. We really don't want asymptomatic people, so in other words, people with no symptoms just coming in for tests for various reasons. It makes it challenging for everybody. It backs up the system and doesn't allow us to provide the responsive care that we need to for those who do have symptoms. We have and we are introducing an online booking tool for our assessment center, which we think will help with some of the flow and make it a bit easier for people to connect. We do want people to make an appointment. This is not just simply a drive in and get tested. It's very clearly structured. We want you to fill out the survey online, connect with the healthcare professional or public health if you feel you need to, but please do a little bit of upfront work before you come into the assessment center, and we will absolutely get you in as quickly as we can and get the results turned around back to you as fast as we can, because we know how important that is. And the last thing I want to do is just give a shout out to our team, as I always do, sort of circle back to the school. There's a lot of anxiety, a lot of worry. We have a lot of young families within the HPHA who have kids going to school. And I know as an organization we're doing our best to support our team. So make sure you're aware of what resources are out there. Make sure you do have a plan. Make sure you're talking to us if you have questions on how we can help. Last thing, just to sort of circle back to my favorite topic, being hockey. Stay a hockey stick apart.